Pride Month is nearing its close, and we are getting a better sense of the healthcare resources available for the LGBTQ community. Tonight, Queen City News reporter Jen Cardone looks at what has changed in 2025 and who local health professionals worry will feel the most impact.
For several years now, Mecklenburg County has provided funding to improve access to health care in the LGBTQ+ community through the health department.
It's about whether or not they have access to the type of care that they want to receive, as well as making sure that that care is readily accessible, easily accessible.
Dr. Raynard Washington is the director of the county health department. He says health care for this community goes beyond testing. It's preventative medicine and education.
The most significant impact that we've had, obviously, are the resources that are coming directly to us that we have now had to stop.
Washington says 5 disease investigation specialists, or DISs, were laid off at the end of May when the Centers for Disease Control did not release funding needed to keep them. A DIS would help notify people if they were diagnosed with or exposed to sexually transmitted diseases.
Now they're going to experience some delays in that outreach that we typically do because we have just overabundance of cases.
Meaning more work for the remaining staff. Washington says HIV cases have stayed stable, but there is a resurgence of syphilis and higher volume of chlamydia and gonorrhea in the county.
It is impacting the LGBTQ+ community, but also other communities as well.
Mental health could also be affected. The Trevor Project is an extension of the National Suicide Hotline for LGBTQ+ youth. It was ordered to be shut down on July 17th.
Many youth and young adults do not have that supportive person, so they turn to resources like the Trevor Project when they are struggling to have that support, especially when they are in times of crisis.
Rebecca Collins runs youth outreach and education with Mental Health America of Central Carolinas. She says last year in North Carolina, 1 in 10 high school students attempted suicide, and that number was higher for LGBTQ+ youth.
I think it's unfortunately safe to say that those numbers will increase if LGBTQ young folks do not have the resources and support that they need.
The youth that you work with, they're in the progress of making those decisions and trying to figure things out. How does this impact them down the road if they don't have that lifeline?
I am seeing the increase in anxiety of young folks being afraid to come out to loved ones, to speak on their identity because they're fearful when they're seeing these messages.
Collins and Washington say education and work to eliminate stigma around the community could make a huge difference.
Those stigmas cause people to not seek care, creates an environment where people cannot seek care, and that's really important that we don't fuel rhetoric that's going to further stigmatize anyone in our community.
Jen Cardone, Queen City News.
Queen City News Plus. Just search Queen City News on your smart TV's app store.